Cold hands and feet are something almost everyone has experienced at some point. For many, it's nothing more than a passing discomfort, often dismissed as the result of cold weather or sitting still for too long. But when this sensation becomes frequent, persistent, or occurs in warm conditions, it can be an important signal from the body. Understanding why it happens is vital, because the causes range from harmless environmental triggers to underlying medical conditions that require attention. To understand cold extremities, it helps to know how the body regulates temperature and blood flow. The circulatory system delivers warm, oxygenated blood to every part of the body. However, the body prioritizes vital organs like the heart, brain, and lungs. In certain situations, such as when conserving heat or responding to stress, blood flow to the extremities is reduced, causing the hands and feet to feel cold. This response, known as peripheral vasoconstriction, is a normal protective mechanism in cold weather, but can become problematic if it happens excessively or without reason. Environmental temperature is the most obvious cause. In cold weather, small blood vessels in the hands and feet narrow to minimize heat loss, redirecting blood toward the body's core. While this is a healthy response, it's temporary and typically resolves once you warm up. However, when coldness persists indoors or in mild climates, the cause is likely more complex. Poor circulation is one common cause. Conditions like peripheral artery disease, PAD, occur when fatty deposits build up inside the arteries, narrowing them and reducing blood flow. This lack of circulation makes it harder for warm blood to reach the hands and feet. Symptoms may include numbness, tingling, or pain alongside the coldness. People with PAD are often at higher risk if they smoke, have high cholesterol, or have diabetes. Without proper treatment, PAD can lead to more serious complications like ulcers or infections in the extremities. Raynauds phenomenon is another frequent cause. This condition affects the small blood vessels in the fingers and toes, making them overreact to cold temperatures or even stress. During an episode, these vessels constrict so much that blood flow is temporarily cut off, causing the skin to turn white or blue. When circulation returns, the skin may turn red and feel tingly or painful. While Raynauds itself is not life-threatening, it can be linked to autoimmune conditions like lupus or scleroderma, which require medical evaluation. Anemia can also be to blame. This condition occurs when there are not enough healthy red blood cells to carry oxygen effectively throughout the body. Iron deficiency is the most common cause, but chronic illness, vitamin deficiencies, or significant blood loss can also lead to anemia. Cold hands and feet and anemia are often accompanied by fatigue, weakness, dizziness, and pale skin. Addressing the root cause of anemia, whether through diet, supplements, or medical treatment, often resolves the coldness. Thyroid disorders, particularly hypothyroidism, are another factor. The thyroid gland produces hormones that regulate metabolism, including the body's ability to generate heat. When thyroid activity slows, metabolism drops, and the body's temperature control suffers. People with hypothyroidism may notice constant coldness, along with weight gain, dry skin, thinning hair, and slowed heart rate. Nerve problems, such as peripheral neuropathy, can also contribute. Damage to the nerves that control sensation and blood flow can cause abnormal temperature perception. In some cases, the nerves send false signals to the brain, making the hands or feet feel cold even when the skin is warm. Peripheral neuropathy can result from diabetes, injury, infections, or exposure to toxins like heavy metals and certain medications. Lifestyle habits play a significant role as well. Sitting for long periods without moving can slow circulation. Wearing shoes or socks that are too tight can physically restrict blood flow. Chronic stress can trigger the body's fight or flight response, causing blood to be diverted from the extremities to core organs. Even dehydration can influence blood volume and temperature regulation, leading to cooler hands and feet. In some cases, persistent coldness can signal serious illness. Heart disease can reduce the efficiency of blood pumping, leading to poor circulation. Severe infections or septic shock can impair blood flow to the extremities as the body fights to keep vital organs alive. certain cancers can also indirectly affect circulation and body temperature regulation. While rare, these causes highlight the importance of not ignoring a symptom that persists without explanation. So, how should you respond if you have cold hands and feet frequently? First, consider environmental factors and lifestyle adjustments. Wearing gloves, socks, and insulated shoes can help in colder climates. Regular movement, stretching, and avoiding prolonged sitting encourage better circulation. Stress management techniques such as deep breathing, meditation, or light exercise can reduce stress-related vasoconstriction. Dietary changes can also make a difference. For example, iron-rich foods like lean meats, beans, and leafy greens help prevent anemia. Vitamin B12 and folic acid are important for red blood cell production, while omega-3 fatty acids from fish or flax seeds can promote healthy blood flow. Staying well hydrated helps maintain blood volume, supporting better temperature regulation. For those with suspected circulation problems, quitting smoking is essential. Smoking damages blood vessels, making them more prone to narrowing. Regular cardiovascular exercise strengthens the heart and improves blood flow. In some cases, medications that relax blood vessels or reduce blood clot risk may be prescribed. If you suspect Raynauds, identifying triggers and avoiding sudden exposure to cold can help. Wearing warm gloves and socks, even in mildly cool conditions, and managing stress levels can reduce episodes. In severe cases, medications that dilate blood vessels may be needed. Anyone with additional symptoms, such as severe pain, sores that don't heal, significant skin color changes, or swelling, should seek medical advice promptly. These can be signs of serious underlying problems that require professional treatment. Ultimately, cold hands and feet are a symptom, not a diagnosis. They are your body's way of communicating something about your health, whether it's as simple as a need for warmer clothing or as complex as a chronic medical condition. Listening to these signals and investigating the root cause can improve your comfort, prevent complications, and even save your life. Like, share, and subscribe so you never miss important health insights. And let me ask you this: how often do you find yourself with cold hands or feet, even when the air around you is warm?